Hi friends, this is Dr. Arpita, and today we are going to talk about a very interesting and very pertinent problem for all teenagers and adolescents, and that is polycystic ovarian disease. So I often have young girls coming to me and they have certain period problems, and they are usually inquisitive that they have polycystic ovarian disease, and usually ultrasound is already done, which has that report written that it is PCOD. So let us see what is actually PCOD and when do you come to us and what can we do to sort of keep it at bay. So PCOD is polycystic ovarian disease or polycystic ovarian syndrome. So what happens is that the egg which is supposed to come out of the ovaries every month, they don't. And so there are multiple follicles within the ovary, increasing the size of the ovaries, and they're seen on ultrasound as multiple follicles in the ovary. So what do the girls usually have? They either have missed periods or they have delayed periods. So some amount of cycle variation is normal for all, right? Not everybody has a 28-day cycle. It can be anything between 24 days or till 35 days. But when the cycles are prolonged for most part of the year, then maybe you have some component. Then you look for other features. For example, if you have acne, excessive acne coming on your face, that is another sign. And the third thing is if you have any new coarse hair growth coming under the chin on your lip line, which was not there earlier, or else it is a continuous crop of new hair which is coming, lower abdomen, on the breasts, inner side of the thighs. So any two of these three features will make you polycystic ovarian syndrome. And the third one I missed out is the ultrasound picture. So remember, it is not the ultrasound picture alone which makes you PCOD. Usually, when two out of these three are there, then the women or the girls are started on treatment, and the treatment most commonly are oral contraceptive pills. So most girls are very apprehensive on taking a medication, and especially a hormonal medication every day. So let me assure you that the risks of your PCOD being there is much more than some side effects that we talk about for the drugs. These pills actually make the cycles regular and they control the symptoms of PCOD. So, depending on your body type, there are different therapies available. You will have to consult your gynecologist to decide which pill or which medication will be right for you. Very common question is what can I do to keep it at bay? So there are two things. One is a very good lifestyle, which includes a lot of exercise. So we have stopped exercising over the few years. We have mobiles to talk. We do not walk in the house. We have cars. So what is effectively happening is that it is a total sedentary lifestyle. So bring in gym, walking every day, swimming, skipping, all the aerobic activities that you can do. That will be something like 5 days a week. And this is especially important for students. So preparing for exams, I say that instead of your sleeping hours, just subtract half an hour from that and keep that half an hour for good skipping, exercises, walking, running, anything that you love. And the second thing is to go on a healthy lifestyle, which includes stopping processed food. Don't have too much of momos, noodles, Maggie, going out with friends, having food outside. Concentrate on good food, home food, lots of salads and lots of fluids, which will make sure that the body is getting adequate amount of antioxidants. My final message is that PCOD is not something which you carry on throughout life. So I have women who say that I have been suffering from PCOD since my childhood, and actually they have no features. So your clinical features decide whether you have PCOD. Number one, number two, you do not carry it for life. If you are treated, maybe this polycystic picture will go. And if untreated, yes, then apart from the period problems, you have acne, hair growth, fertility problems. And in the later on, further down in your age line, there are higher chances of endometrial cancer if PCOD is left untreated. So, with all these things, I will attach a link for you to go through. That is by Mayo Clinic, so that you understand the do's and don'ts much more properly. And if you have any queries, you can come back to me on this channel. Goodbye for now. Bye.